Welcome to today's press briefing. We have with us, they are from the Center for Health Protection Communicable Disease Branch, Dr. Chang Shuk-kwan, and Chief Manager of the Hospital Authority, Dr. Gladys Guam. The two doctors will report situations about the hospital authority and the cases situation. Dr. Kwan, we have 1,690 patients staying in hospitals. 223 are new cases. Those in isolation facilities, there are 481 in isolation ward, 84 in second-tier isolation wards, and 525 patients in North Lantau, Hong Kong Infection Control Center. There are 188 new cases. Yesterday, we have reported 4 patients in a critical condition, 2 in a serious condition. Those who are staying in hospitals, there are altogether 31 critical cases and 22 serious cases. 10 critical cases are in ICU. Yesterday, we reported a 5-month and 5-year and 9-month-old case. It's a girl. She's still in a critical condition staying in ICU. We'll closely monitor her situation and provide her with suitable treatment. Her 11-year-old sister was also confirmed, now staying in a pediatric ward in Tuen Mun Hospital and in a stable condition. We appeal to parents once again, do not hesitate. Take your children to get vaccinated to give them the proper protection. Vaccination is the most effective way to guard against serious cases as well as fatalities. We report 3 death cases, 2 males and 1 female aged between 80 to 89. There is 1 case from a care home. 2 of them have no vaccination record. 1 has had 3 doses. And these are the information of the death cases. The first one is an 89-year-old female suffering from hypertension, had a stroke before, and also high lipid. And on the 12th of August, she went to the A&E department because she suffered from lack of appetite and discomfort for a number of days. And on the 12th of October, when she came to the A&E department, we saw that she suffered from shortness of breath, serious dehydration, and vomiting. We provided her with resuscitation, and she was intubated. We found out that she was confirmed with COVID-19 with a CT value of 19.4. During treatment, her heart disease, there was a heart disease and also serious kidney failure. This is a case that is unvaccinated. The second case is an 80-year-old male, also no vaccination record, suffering from chronic kidney disease. On the 9th of August, when he came to the A&E department, he said that he had a fever and was RAT positive. He said that he suffered from dizziness as well as lack of appetite. He needed high level of oxygen. He was intubated. Her X-ray was quite opaque. We found that he was confirmed with a CT value of 18.3. We also found that we have cultured bacteria from his phlegm from the lung. His condition deteriorated and passed away yesterday. The last case is 89-year-old male with 3 doses of vaccine, suffering from diabetes, high blood pressure, and also arrhythmia. And on the 11th of August, he was found to have lost consciousness at home. When he was sent to the A&E department, there was no vital signs, and we found that he passed away, and his case was transferred to the coroners. We received telephone calls and found that the wife was confirmed. We informed the police and also informed the public mortuary. Yesterday, when we checked the record with the CHP, we found that on the 11th of August at around noon, he went to a community testing center to get tested. His CT value was 21. So we found that For the 3 death cases, there are 2 elderly people without any vaccination. And in the previous few days, they had some symptoms, and these common symptoms are lack of appetite and lethargy. Very often when they arrived at the A&E, we found that they suffer from serious dehydration. So we make use of this chance to appeal to you once again that if you're elderly and if you suffer from discomfort, go to see a doctor. And if you suspect that you might be infected with COVID, please get tested. If it's a positive case, please report your case. Approach us to see if we can help you. You can call our hotline, our support hotline. You can also make a booking with our designated clinics and make use of the appointment system under HA Go for a remote consultation. Suitable patients will be prescribed with oral medication. Of course, the most important thing is to get fully vaccinated, especially if you are elderly, chronically ill, or if you are young. 133 patients have recovered, including 119 that have been discharged. 5 patients were identified to be positive upon admission screening. 8 patients in the same ward have been classified as close contacts. For staff members, we have another 54 staff members that have been confirmed. 13 staff members have resumed their duties. That's all for my report. Dr. Chuang. For local positive cases, we have 4,764, including PCR positive cases 1,534 and verified RAT cases 3,230. We have 215 cases of imported cases, PCR cases 195, and 10 RAT cases. We want to update the figures yesterday because of technical issues. We have further verified the cases reported yesterday. For local positive cases, yesterday, 25 of them were actually imported cases picked up at the airport. For yesterday, positive cases, 5,123 cases, imported cases 185. Dr. Kwan talked about 3 death cases. So far we have 9,352 death cases in the 5th wave. Of the imported cases, there are 121 picked up at the airport, 79 are picked up within the 7 days or at quarantine centers, including 22 from the community testing centers and 20 cases that are identified after the 7 days. They have high CT values, so they might be repositive cases. For the 215 cases coming from 51 places, 7 places imported more than 10 cases, India, UK 31 cases, US 15, Thailand 13, Pakistan 12, Singapore and the Philippines 11 each, and for the other 44 places they have imported less than 10 cases. In relation to care homes, we have 5 care homes with cases. So close contacts will have to be quarantined. In Yuen Long, Ga Yin, Yuen Long, Wu Lei Yuen, 1 resident positive and 9 residents and 2 staff members have to be quarantined. Salvation Army, Bradbury 慈愛長者之家 1 resident and 3 residents will have to be quarantined. 福苑護老中心有限公司 in Sai Kung, 1 staff members that have been confirmed, 1 resident has to be quarantined. 德昌護老中心興芬苑有限公司 in Kwai Chung, 1 resident positive, 3 residents will have to be quarantined. 紫雲間融日護養院暨長者日間護理單位 1 residents confirmed, 4 residents and 2 staff members will have to be quarantined. For schools, there are no new reported cases, so no classes have to be suspended. We have an increasing number of cases related to subvariants. For preliminary figures, as at the 11th of August, suspected BA4 or 5 It has increased to 23.1%. BA.2.12.1, it stays at about 7.3%. That's all for my report. Thank you.
The floor is now open to questions. Please put up your hand. Our staff will pass you the microphone. Before putting your questions, please identify your media outlet. The first question, the journalist, on the second last row on the right. I'm from Now TV. A follow-up on the girl you reported yesterday. Did the younger sister pass on the virus to the older sister? How's the older sister doing? Is she in a serious or critical condition? Have you identified the source of infection for the 5-year-old? For this case, we're still investigating the case as to where the source of infection is and how the family members are doing. Now, we haven't come to a conclusion as to who's passing on the virus to whom or whether it's a case of community infection. Now, for the 11-year-old, she had sore throat, but overall, she's in a stable condition. Next question. Second last row, the gentleman over there. Oh, sorry, what's your media outlet? I'm from cable TV. Do you have confirmed cases found during the 4 days of medical surveillance? The follow-up on the case of the 89-year-old male. On August 11th, he was at the testing center. Is it because of a delay in the test result leading to a delay in his attempt to seek treatment? Now, for imported cases today, 22 cases were found between day 4 and day 7 at community testing centers. Now, for the 89-year-old male, the chronology is that around 2 p.m., he was at the community testing center. Around 4 p.m., he was found unconscious at home, and then he was taken to an A&E department of a hospital. The case has been referred to the coroner's court to find out the cause of death. We don't have a conclusion on the cause of death yet. Next question. Any other questions? If there's no other questions, on the left, second last row, the gentleman over there. I'm from Ming Pao. For the 5-year-old girl, do we know which strain is involved? That is, which kind of L452 strain? Is she still unconscious? Does she still have a fever? Is she still having convulsions? For the 11-year-old girl, is the 11-year-old vaccinated? Is she displaying no other symptoms other than sore throat? For the BA.4 and BA.5 cases, for cases from care homes, do we have recent cases? Do we have reinfections involving BA.4, BA.5? And for BA.4 and BA.5, do we have the specific proportion, a breakdown for BA.4 vis-a-vis BA.5 cases? Now, for the 2 death cases, the 2 unvaccinated elderlies, did they stay with their family members? For the triple jabbed 89-year-old male, when did his wife get confirmed with COVID? Did he experience discomfort for a few days before his death? Now, we're doing spot checks for BA.4 and BA.5 as to the L452R strain. So we don't have the specific figures to the the BA.4 vis-a-vis BA.5 cases. In the community, including care homes and hospitals, some will carry the L452R, that is suspected BA.4 and BA.5 cases. The proportion has risen to more than 20% today. This is the figure as at August 11th. In maybe 5 cases, there's one involving the L452R strain. Now, for the 5-year-old girl, now we haven't received a report as to which strain is involved. As we said, she's still in a critical condition under intensive care and requires both medication and support from equipment. We will continue to monitor her condition for any changes. For her sister, the 11-year-old, she's fully vaccinated. Aside from the sore throat, her condition is relatively stable. As for the deaths, the first case, the 89-year-old female, she stayed with her son. As for another case, she was from a care home, but she went out. Her family would take her home for care. During her stay at home, she stayed with her family members. As for the wife, at around 11 p.m., she called the A&E department, informing us that the wife also was confirmed with COVID. As for whether he had other symptoms previously, where there are no records on this, his family members didn't tell us whether he felt ill earlier. Now, you mentioned reinfection cases. Based on the daily figures, roughly 1% of the cases every day involved a previous infection. These may be cases of reinfections. Next question. On the left, the gentleman at the front. I'm from News. Now, for the 3+4 quarantine arrangement, how many people with Amber Code have been confirmed with COVID? Do you have the percentage? Second, Secretary for Health said that the 3+4 arrangement it may have an impact on the number of arrivals. Are you worried about more imported cases, and what will the authorities do about this? It's said that it's against the law for those with Amber Code to visit their family, their relatives. What will the government do to step up enforcement? Now, infection numbers are rising. Aside from appealing to parents to inoculate their children, what other steps are the authorities taking in response to this problem? Now, for imported cases, we have 22 such cases today, involving cases picked up between day 4 and day 7, cases picked up in the community. Now, we believe they are people with the Amber Code. Now, there are more spots at designated quarantine hotels due to the shorter quarantine period. And more people will be able to enter Hong Kong. If this proportion stays the same, then there will be more imported cases in terms of the absolute number, but that's expected. As for those with an Amber Code, they have to do the daily tests after leaving the quarantine hotel on day 2, day 4, day 6, and day 9. They have to get tested, and they also have to do daily rapid antigen tests to, if they are infected, the testing will help pick up the case earlier on to minimize the risk of community transmission. That's all from me. Next question, last question, the gentleman over there. I'm from AM 730. For the 22 cases picked up between day 4 and day 7, do you have a distribution of where they are from? In terms of where they've been to, have you looked into where they've been to in the community? Now, for BA.4 and BA.5 cases, you said you would do spot checks. Can you give us more details in terms of the spot checks and in terms of the analysis of the strain involved? Now, for those under medical surveillance, is there a restriction on where they can go during the medical surveillance if they decide to go to a gathering? You mentioned there's a revision to the breakdown in the figure. What kind of technical issue is it? Is there a human error? What kind of factor is at play?
In terms of classification of subvariants, say L452, after an RAT has been done, we would verify. And we also have the PCR as well. We will conduct L452R analysis. We conduct about random sampling for about 2,000 to 3,000 cases. The technical issue is beyond me because I'm not an expert. I don't have much information. I think that the relevant parties are, well, they were working on it to fix it. In principle, we don't want them to engage in any off-mask activities. That's the end of the press briefing. Thank you.